Greetings and welcome everyone to our midday, almost 12:15 noon seminar. And a special welcome to those who are joining by Zoom. Many of you, I think, for the first time. So welcome to the Department of Population, Family, and Reproductive Health virtually at the School of Public Health at Johns Hopkins. So I have the honor, Cynthia Minkovitz, of being chair of the department, and I'm going to moderate our discussion today. I want to first do a special thanks to Alexis Campbell and to Sylvia Thomas for actually helping organize all of today's happenings. So huge thanks. So our seminar today is co-sponsored by Maryland Family Network and the Building Better Beginnings Initiative, which we affectionately call B3. So B3's mission is to establish, enhance, and expand high-quality programs and services for at-risk expectant families and those with young children across the state of Maryland. Today's topic is especially meaningful because we recognize, as we think we're emerging from the pandemic, of the vital role that food access plays in promoting nutrition and health equity for all children and families across our state. And we also know, and several other speakers will address this, of the critical role that communities, state organizations, and federal partners play in crafting policies and activities that can support access to healthy foods. Because we have such a wealth of talent and expertise among our speakers today, I'm going to briefly introduce each of them before they come up to share some remarks, and then we'll open it up for broader discussion because I know we have lots of other expertise both online and in the room. So first, Dr. Susan Gross will orient us to our topic for today. She's an associate scientist in the Department of Population, Family, and Reproductive Health, and a nutritionist, researcher, and an evaluation specialist with over 20 years of experience in nutrition education and evaluation. She's worked on initiatives to increase WIC child participation and retention, evaluate the impact of baby-friendly hospitals on WIC participants in Maryland, and improve food security status for adolescents and youth here in Baltimore City. She's also a nutritionist with the Johns Hopkins WIC program. And I should add, but it's not on your bio, you're right down the hall from me, and I'm in your office seeking your expertise on many occasions on all sorts of things. Next joining us will be Dr. Darriel Harris. He's the inaugural Cynthia and Robert S. Lawrence Fellow at the Johns Hopkins Center for a Livable Future. He recently graduated from the School of Public Health with his doctorate, and his dissertation focused on the persuasiveness of faith-based health communications to faith-based audiences. He's also a pastor at Newborn Community of Faith Church, and he's extensive work with religious organizations to improve the health of members of communities. And rudely, we asked you to send slides in the day after Easter Sunday, so our humble apologies for that. But we're thrilled to have you here. And I'm equally thrilled that Dr. Felicia Jones-Taylor is joining us to share some new resources from the Building Better Beginnings, or B3 initiative. These resources have been developed in partnership with colleagues from the Food Research and Action Center, or FRAC. And she's the Prenatal 3 project director at Maryland Family Network, a longstanding partner of ours in the department. She's also an incredible prenatal to 5 champion, and her focus is improving systems to better serve children and families by encouraging agencies and organizations to strategize around parent and caregiver voice. She earned her doctorate in education here at Hopkins, and she brings a lot of expertise, having worked in diverse early childhood settings in the Baltimore, DC area. So without further ado, Susan, I'm going to invite you to come up and get us oriented.
Thank you, Cynthia, and it's an honor to be here, and especially on this panel. So today I'm going to speak about 3 things. One is the importance of nutrition during early childhood, about issues of disparities in food access for early childhood, and then also some lessons we've learned during COVID. Especially around food access programs. So first, quickly about what is the importance of nutrition during early childhood. Adequacy of nutrition during infancy and early childhood is essential to a child's growth and development. In fact, deficits during this early childhood period can lead to impairment in growth and health. And it's also that in this early time, we are setting the stage for eating habits for the rest of their lives. Just a little bit about what are the recommendations for this time of life. One is that from 0 to 6 months, breastfeeding is the recommended and optimal way to feed infants. As children become developmentally ready, the introduction of complementary foods as solid foods are recommended, as well as then as infants become toddlers, learning to eat a variety of foods, to learn about textures, to learn about social situations with eating, and also about developing a healthy, diverse pattern of eating in a family situation. Just to touch on what do we know about how these recommendations are being observed nationally, but also here in Maryland. Breastfeeding initiation rates vary in the state of Maryland by county. The darker colors indicate lower rates of breastfeeding initiation. So breastfeeding initiation means ever breastfeed, ever putting the baby to the breast. And in Baltimore City, our initiation rate is 71%, which is, I guess I can use this little Baltimore City is here. So as we go west and south, we also see lower rates of breastfeeding initiation compared to Central Maryland. What do we know about toddler eating? So recently in the 2025 dietary guidelines for Americans, they came out with dietary guidelines for kids less than 2. This is the first time this has ever been seen. And there's actually been developed a toddler diet quality index. And nationally, as it's been reported most recently, the average is 49 out of 100 points, which means toddlers are consuming or under consuming some of important food groups. They're under consuming seafood, greens, beans, and plant proteins. On the other hand, they're over consuming some food groups such as refined sugars and added sugars. And this includes beverages with added sugars, not just, and probably more processed foods, which have more refined grains. In fact, we see that this early lifetime diet consumption sets the stage for later, even later in early childhood. So this chart is about how percent of energy for major food groups, which are colored, the different colors in the bars, compared to ages in months. So early life, the majority of calories come from infant formula or milks or human milk. But as children age, we see an increase of consumption, and those areas that we see the biggest change in are the grains, which is red, and the meats, and then also the sweets. We don't see as big a change in the percent of calories from fruits and vegetables. They stay pretty constant. But we see a large decline in the milk, which actually is part of the recommendation. But at times it gets lower than we would like. As a source of calcium, we'd like to see children consuming milk products to provide calcium. So switching to access. So we know that nutrition is really important and access is really important for these children. They need to be getting this variety and these diet quality every day of their lives. Well, in the United States, how we measure diet quality is food security. It's usually measured by household and not by individual. And we do see some statistics that talk about how all US households, which is our chart on the left, and then prevalence of households with children. And these are with children under 18. But the thing I want to draw your attention to is we did see a big increase around 2008 in the recession, and then it has steadily come down since then. But really, for all households, the prevalence is lower than the prevalence of food insecurity in households with children. So the top line is food insecurity. That means that they are having trouble with availability and balance in their diets. And then we see the next line down is food insecurity among children. This is when the households report that they are limiting the foods they eat because they don't have enough food money in their budget for food, and those are when children are affected. Very low food security indicates hunger. Food insecurity also varies geographically. So this is a map of the United States about the average percentage of food insecurity by state from 2019 to 2021, which is during the change from before the pandemic to during the pandemic. And what we see is the highest change or the highest levels of food insecurity, which were above the US average, are in the Southeast. And we see some in the Rust Belt, like Kentucky and West Virginia, and the lowest are in the Northwest and the Midwest, and some in the Northeast. But I want to say that the lowest was in New Hampshire with a rate of 1.9, and the highest was in it's in Arkansas, and their rate was 15.3. And I'm sorry, it was Mississippi. Arkansas was the next, but yeah, 15.3. So geography, it varies, but it also varies by racial ethnicity group. And this chart is most recent chart produced by the Economic Resource Service of the USDA. And this is from December 2021 to March 13th, 2023. What I want to, this is about child food insufficiency, which is different than food insecurity. Households were classified as food insufficient for children if the adult survey respondent said children in the household were not eating enough, sometimes or often in the last 7 days. So it's referring to the children's not being able to eat enough. It varies by race and ethnicity. And over time, we see that the rates have stayed pretty, they've been rocky, but they've come back to levels of 2021. But there's still disparities. They're still higher in the Black non-Hispanic group, and the Hispanic group, and then other non-Hispanic group, and it's lowest for the white population. But I also want to say that it declined, but it's not from the peak we saw in about March 2020. We see this peak, but it still has not resolved. In the Delmarva, DMV, the Delaware, Maryland, Virginia area, the Capital Food Bank has done recent work on the hunger report. 1 in 3 people had expressed some level of food insecurity during the previous year. And if you look, I know it's a little blurry, but respondents experiencing food insecurity were disproportionate communities of color. And the highest groups were the Hispanic and the non-Hispanic Blacks, which 55 and 50% among those were identified as food insecure. And I also want to say that it also represents the fact that we are seeing, or we want to acknowledge the role of systematic and structural racism, both historical and in the present day systems that are drivers of inequity in our region. And there's been long-standing discriminatory practices related to employment, education, housing, lending, municipal planning, and many other areas. And we also see the highest rates among those who are unemployed, lower education, unstably housed. In fact, renters have very high levels of food insecurity. Why am I so concerned about food insecurity? Well, there are health consequences. So for our youngest children, when we find that 57% are more likely to have upper respiratory infections who are food insecure. 3 times more likely to have frequent stomach aches for the 4 to 5 year olds, 2.5 times more frequent headaches, 30% more likely to be hospitalized for those who are 3 years and under, and 90% more likely to have fair or poor health versus good health. We also know that children who experience hunger are more likely to have delays in development, motor skills, have behavioral and emotional problems, and academic problems. Children less than 4, food insecurity is related to poor health and developmental risk, and not necessarily related to their anthropometric measures. So being underweight, it's more related to just the fact of hunger. And then food insecurity in early childhood is predictive of poor mental health outcomes in adolescence and beyond. But we do see the tracking for disruptive behavior, depression, anxiety. So on the good news, we have learned some things about food insecurity and providing food access through the natural experiment of COVID-19. So before COVID-19, there were a lot of strict rules in our USDA supported food supplemental program. During the pandemic, we saw big flexibility changes that happened that help with food access. In the SNAP benefit program, we saw that everyone on SNAP got the maximum benefit during the pandemic, which for some families was over $100 increase each month per person. And then pandemic EBT was a way of getting money to those families who were missing in-school meals. Families were depending on 2 meals a day during the school year, and pandemic EBT tried to relieve some of that school meal loss through supplemental support, either through adding to their SNAP benefit or providing families with cards they could redeem at the store. The child nutrition waivers happened. They happened for the school lunch, and flexibilities were made so people could go get non-congregate meals, multiple meals at a time at remote settings with parent pickup, and children did not have to be there. And then emergency food systems had food boxes delivered to families around, especially in Baltimore. The WIC program also had flexibilities. With waivers, for the first time ever, we were able to do our services remotely. We were able to get children on the program. We were able to get do everything like issuing benefits, and there was electronic benefit pickup for families in WIC. So okay, so again, these are the programs that help supplement, and I won't take up any more time. And if we have questions, I can talk about all of these programs at the end.
Okay, well, I'm going to follow that presentation with a description of some faith-based work that has happened here in Baltimore and beyond. The reason why this is important is because many of the issues that Dr. Gross just mentioned around food access and childhood hunger are also things that, if we were to zoom in, she showed the map of the United States, and Maryland relative to places like Mississippi, Texas, Arkansas, looked like it was doing fairly well. If we were to zoom in on Maryland and zoom in onto Baltimore, then we would see that relative to one neighborhood relative to another, there's neighborhoods in Baltimore that are doing quite poor in terms of food access and food insecurity and childhood hunger and things of that nature. And so a lot of these programs began with the ambition of addressing that. So I'll start by talking about the Baltimore Food and Faith Project. This was the first project that I began working on back in 2013. And so the Baltimore Food and Faith Project was an initiative of the Center for the Hopeful Future. And what we were trying to do was to work with faith-based groups to modify the food system. And so we were engaging with these houses of faith to try to convince them to source their food organically, source their food more locally and regionally, and to have the food that they serve at the congregations be more healthy. And so the way that we did that went through some congregational gardens. And so you can see the image on the bottom left, there's a congregational garden. We also did this through a series of educational workshops and cooking demonstrations, which you see on the top right. And so the cooking demonstrations is fairly straightforward. We would bring a chef or somebody that was culinarily skilled, someone much more skilled than myself in that arena. And they would come in and they would, they would do a cooking demonstration and show people how to cook. And we did it with apples. We did it with all these seasonal vegetables and a host of other food elements, beans and things that people may be familiar with. And we're showing them new ways to cook it, or things that we were introducing to people like eggplant or bok choy. These were kind of things that people didn't have a lot of experience with. And so we do these cooking demonstrations. We also dabbled into using theological insights to convey the importance of healthy eating to congregational members. And this was kind of the innovation. And so we came up with a curriculum. Yeah, like 3 curriculums. The first curriculum we developed was a childhood summer program curriculum where the children, we were, walking children through how to grow food from a seedling, and then, how it matures and becomes a plant, and eventually you either eat the leaf or it bears fruit, and then you eat the fruit from the leaf, from the plant. And then we had a curriculum that showed the congregation. It walked us through all the different labels of the food system. And so you go into a grocery store and it says natural. This one says organic. What does that mean? What does it mean for a food item to be natural? What does it mean for it to be organic? What does it mean? Does it mean that it's healthy? But a lot of times we see organic and then we think that means healthy. And then they start selling organic Gatorade. And so that means I can give my kid all the organic Gatorade, and therefore it's gonna be better, right? But that's not the case, right? And so we had to. It was an educational series to teach that. And then the last thing we did was a theologically based educational series around nutritional eating and breaking habits that people have grown that inhibit healthy eating. And then we also did a series of workshops in congregations, like you see the picture in the middle. There we have a bunch of speakers. Some of those are farmers and organizers sitting around the table, and they're talking, and there's a community discussion around the food system and around what congregations can do. And we introduce farmers and talk about the challenges and why everyone just can't do it, and why why the food system is the way it is, and what support these different groups need in order to make it more robust and something that will be beneficial for our children. How to bring the mouse back. Oh, okay, I see it on the screen. Okay, great. Okay, no, well, this is actually how it is. So, okay, so that was the Baltimore Food and Faith Project. I'm kind of doing these after the Baltimore Food and Faith Project, we came something called the Black Church Food Security Network came to be. And so the Black Church Food Security Network, the first thing that the Black Church Food Security Network did, and the motivation behind the Black Church Food Security Network was that the people that were suffering the most from food insecurity, they tended to be African American. And they tended to be in neighborhoods that had large portions of African American residents. And so Sandtown, Winchester, Upton has 95% African Americans. It's what we used to term call it a food desert. I think now the term is food apartheid, or Baltimore City uses the term healthy food prioritization area. which is to say, it's an area that doesn't have, if you want to get healthy food and you're living there, it's a struggle. You have to really go out of your way. And so, but in these areas, there's lots of Black churches. And so Heber Brown was really the brainchild behind it. So Reverend Heber Brown, myself, and Aaliyah Frazier, who's pictured in the far right in the denim. She's a farmer who was growing food on Harriet Tubman ancestral land on the Eastern Shore. Came up with the concept of a soil to sanctuary market. And so it started off with her, with her right here. She was a farmer, Aaliyah Frazier, also a Hopkins grad. She's pretty popular. So she would grow in Harriet Tubman's ancestral land on the Eastern Shore. She would drive a fair amount of produce to be started at a church on North Avenue on the east side. And they had like a Wednesday midday Bible study. And then we set up while they were in Bible study. And then as they came out of Bible study, then they had all this fresh produce that was there. And that we call that our soil to sanctuary market. And so it availed fresh produce and fruits and vegetables and all these healthy items, all of them grown using organic methods to a population that had challenges getting it. And then it came with a narrative that made people want to buy, because you're telling people that you're buying food that, like, this is the soil that Harriet Tubman stepped on. This is about freedom. This was about coming out of oppression, all of which are things that the Black church talks about fairly regularly. And so it was an incentive. So we started with doing the Black church student soil sanctuary, and then we started growing church gardens within congregations. That's what you see on the far left here. Oh, there's a handsome young man here speaking. Oh, that's me. Sorry. Yeah, so we were doing church gardens and then kind of like doing the ceremony for those church gardens and kind of opening them up. And we did that around like 20 congregations around Baltimore City. And then now the Black Church Food Security Network has really grown. There's connections with farmers in Virginia, Pennsylvania, and North Carolina. I am not involved in the day-to-day anymore. It's really spearheaded by Reverend Heber Brown. But this is the network. In the middle, you see the chart there with all the church symbols. So this is how the network has grown. And so all these congregations within the network are doing some form of food-related work and working with farmers or improving food access in their various areas. And then there's something in Baltimore called the Strength to Love Farm. And so Baltimore, after, I think it was in 2013, 2012, legislation changed that allowed for hoop houses to come in the city. The legislation allowed for the utilization of hoop houses, which are these passive greenhouses, kind of half dome structures. It also allowed for hens and allowed for raising of pygmy goats. The hens have done well, the hoop houses have taken off. I haven't seen any pygmy goats yet. But this is one of the farms. And so Strength to Love 2 Farm is, it was started by Newborn Community of Faith Church. It's on the west side. It's in Sandtown, Winchester, which is one of the areas that we have called a food desert, or food apartheid, or healthy food prioritization area. It's also where Freddie Gray lived and where he was arrested and ultimately sustained the injuries that led to his death. It used to compete with Real Food Farm for the largest farm in Baltimore City. And so Real Food Farms has now moved on to greener pastures. And so this remains the largest farm in Baltimore City. It was started by a church. It was initially intended to find employment for people coming home from incarceration. And then once they were just looking for a way to employ people. And then once they started employing people, then they kind of realized that they were in the middle of this whole organically local food system movement that they kind of stumbled upon without it really being intentional. But nonetheless, they become a major player. And so you see here some of the produce being grown. There are 16 hoop houses on the land. There's, depending on the season, there may be bees. They're moving into having a aquaponics setup, not aquaponics, excuse me, a hydroponics setup. Aquaponics means there's fish and plants working together. Hydroponics means that there's plants that are being grown outside of soil, plants are being grown in water. So they have a hydroponics development coming. The gentleman in the middle, bent over, is the new farm director. Eberfall comes with a vast amount of experience, but he's growing. And so a lot of this food ends up, before the pandemic, it ended up at the farmer's market and it ended up in your high-end restaurants in Baltimore City. Most of those high-end restaurants that were buying from this farm shut their doors during the pandemic. And so now a good portion of the food is ending up in the Maryland Food Bank. It's ending up in a few neighborhood partners who receive the produce, as well as the farmers market. But this was started by a church. It's a significant, largest farm in Baltimore City currently, and it was started by a church in the area that has low food access. All right, this is the last project. So this is called Church Lands. It used to be written right here. So they all just disappeared. And so this is actually an initiative that it's a US-wide initiative. This is a farm. This farm here is called Plainsong Farm. It's in Michigan, but a fair number of our churches in the Baltimore area have been involved. And so these are some more images of, this is Plainsong Farm. This is Nuria Parrish, who is an Episcopal priest. And she's doing an outdoor service. And this is one of our gatherings with religious leaders from across the United States. And so what this initiative is intending to do is to encourage congregations to use their land in ways that are faithful to their religious tenets and in ways that are regenerative. And so there's lots and lots of churches all over, churches and other religious bodies all over the United States. A lot of them have land. A lot of them are now becoming defunct. Attendance is down, particularly in rural areas. And so they have to figure out what they're going to do with, what are you going to do with this closing congregation? And so we've been working with them, try to get them to use it to allow for regenerative farmers to use that land and to grow. And so even in less rural settings, more urban settings, we're still finding congregations closing their doors. Those congregations still have land, and so we work with a fair number of congregations to allow them to allow for new farmers to farm on that land. Even if it's a thriving congregation, sometimes they have land that's underutilized. And so we're asking them to allow that land to be utilized for the purposes of food generation in a way that is in sync with their religious tenets. And so we do that through farm visits and then through educational series. The picture on the far right was taken at Wake Forest. And we've had these also at Duke University, and we've had them in Michigan. And hopefully one day we'll have one here in Baltimore at Hopkins. But leaders from Baltimore have attended all these. And I'm a leader from Baltimore myself, and so I helped organize these. All right, so these are some of the initiatives that are happening faith-based. And so the lessons learned, right? So this represents about a decade of working with congregations in the United States, trying to move the needle towards food access, regenerative agriculture, growing in food in ways that allows for future generations to sustain themselves. Because the projection now is that if we don't modify our farming methods in very significant ways, that the next generation is gonna have a much harder time feeding themselves than our present generation. And so the numbers that Dr. Gross has shown us are likely to move in a negative direction if we don't change. Right? So these are some of the lessons learned. Churches, congregations are generally, not always, but generally welcoming spaces interested in improving the lives of their members and communities. This is generally, right? It's not 100% of the time the case, but there's so many houses of religion. It's fairly easy to find one that is open to the ideas of improving the lifestyle of their members and the community that surrounds them. There's so many that are willing to work and to learn alongside of public health practitioners who have skills that they don't know, that have information, have data that the congregation has not interacted with yet. And so many are willing and willing, and actually many are hoping and desiring to partner with people and like in this room who have the skill set and this knowledge base to help them and help direct them and move in directions that are better for their people. Another lesson, is that churches need help connecting health behavior to their theology. And this is what I did my dissertation on, right? Like how do you give a public health message such that it is embedded into the language of this group? And so it takes a fair amount of work and energy, but if you do it, then the impact tends to be that one is longer lasting. And so if I go to a congregation and I do a program, and then people come to my program, and then I walk away and the program is no longer implemented, then people get the benefit from me doing the program one time. But if I do the program and I link that program to the religious language, even when I'm not doing the program in the future, as long as the language is evoked, then the messages from that program are also kind of invoked because they're embedded. And the people oftentimes feel a lot more comfortable speaking about it because they're much more familiar with theological language than they are with scientific language. And so churches need help. They need help making the connection, but if you're able to make the connection, then it goes a long way. Also, my dissertation, one of the things I learned in my dissertation process is that the pathways of persuasion are different. So if I go to the doctor and the doctor tells me I should eat more fruits and vegetables because people who eat more fruits and vegetables live a longer life, they have less morbidities, it's healthier for me. And then I go home and I watch TV, and there's a public health announcement that comes on TV that says the exact same thing. And then I go to the doctor again in 6 months and they tell me the same thing. Sometimes it's as if I heard it once because it's the same message using the same logic. But if I hear it then from using a religious logic, same message, but religious logic, now I've heard it 2 times. Because the pathway of persuasion using the religious logic is different from the pathway of persuasion using scientific logic. And so the more I can incorporate some of the religious language, the more times that people actually hear the message. And if I hear a message twice versus once, then it's usually more persuasive. It's additive. Okay, so another note about congregations that church leadership is often overwhelmed, right? So it's one thing if you go to a church and you say, hey, I want to work with you to do this program. And you say, okay, let's meet on Wednesday to invent the program. And then you sit down and it's like, it seems overwhelming. And the person's like, I don't know, this is not really my language. It's not really my strength. I don't know what to do with this. This is too hard. So if you can pre-package it and say, okay, I have a program that could be beneficial to your congregation. It's here, it's ready to go. I can share it with you such that you can modify it, or you can evaluate it to see whether or not it's good, whether or not it works, it fits. You can do that, but it doesn't require the leadership to do a lot of work just to get started. You want it to get started as easy as possible. Also, clergy tend to engage well with other clergy. And so if you are desiring to work with religious groups, sometimes it's good to have a religious person on your recruitment team. It really breaks down some barriers. I'm not sure why, but clergy tend to like other clergy. They understand each other. They speak the same language. They understand the difficulties. And so it helps. So, okay, so these are my lessons learned. These were the initiatives that I've had experience with over the past 10 years, working with congregations, blending faith and food access and food farming methods. And so I hope this was a benefit for you.
All right, hello everyone. I will. House is right.
Thank you.
Okay, I'm Felicia Jones-Taylor, and what I'm going to try to do is talk about maybe some of the issues, but talk about a new tool that we have that you all may want to access as you are either doing some research, whether you are building out programming. I think these maps will be helpful. They do focus on sort of the pregnant people, infants, and toddlers. And so if that's your jam, I think you really want to pay attention. So let's look here. This is one of the maps that we have that you can find on our website, and I'll get to that. But this particular, hold on a second. So let me just start over. So the rates of families experiencing food insecurity in the state of Maryland are, in my opinion, unacceptable. And what this map shows is the rate of food insecurity experienced by children with the darker shades indicating higher rates and the lighter shades indicating lower rates. And what you see here is that child's insecurity is especially high in the southeast counties of Maryland. So looking at Dorchester at 22.6%, Wacomico at 19.8%, and Worcester County at 19.1%. Somerset at 25.6%, and then right here in Baltimore City, that rate is 29.3%. The disparities and gaps in food security often, as some of the previous presenters discussed, result from systems of oppression, including systematic community disinvestment, structural racism, and the disparities in food insecurity and other social determinants of health lead to a widening disparities in health conditions as well. So just a special note for this map in particular, shows the point of locations of community eligibility provision sites, which kind of serve as a proxy measure for the communities with high rates of families earning low income. You can see in the map, it's a high concentration in Baltimore City. So hunger and health and poverty are all interconnected with each other, contributing to a cycle that is really challenging to address. But food security is associated with insecurity is associated with a range of health consequences for babies, toddlers, and their families, including diabetes, iron deficiency, developmental risks, low birth weight, and other pregnancy complications. So I'm about to take a dive, and we're going to look at how you can use the B3 food maps to visualize various health consequences related to food insecurity, including, let's go with low birth weight. So low birth weight is the percentage of live births where an infant weighed less than 2,500 grams, which is about 5 pounds, 8 ounces. So maternal and child health outcomes like low birth weight are an example of serious consequences associated with food insecurity. So in Maryland, the prevalence of low birth weight by county ranges from 6.3% to 11.9% of births. And on this map, the more concentrated the green color, the higher the rate. Just note that this measure uses data from the 2014 to 2020 National Vital Statistics. So the reason we included the maternal vulnerability index on this in these series of maps is because we talked about maternal vulnerability index as a social determinant of health and measures and ranks geographies based on a variety of factors, which takes into account rates of poverty, health insurance, access to healthcare, access to transportation, and mental health indicators. And on average, women in Maryland are less vulnerable to adverse maternal health outcomes than in the US, but if you dig a little deeper into the state, you'll find out that vulnerability ranges quite a bit. So the social determinant of health measure is included in these B3 maps to provide a little bit of context around how food insecurity data can help early childhood stakeholders prioritize geographies, or which areas to prioritize when they are considering doing research or implementation, program planning, things of that nature. So I'm not going to spend a lot of time talking about WIC because Dr. Gardner already gave us some insight, but I'll let the slides speak for themselves. But I want to say that the benefits of WIC are numerous, and so they can address issues like, you know, improving the types of foods that children and pregnant people have access to. It helps with birth outcomes. You know, it helps support the health and development of the family. So here in the state of Maryland, we kind of already talked about earlier that the temporary changes to it during COVID-19 really improved access. So one of those, so we talked about remote services, like being able to sign up online, being able to conduct your check-ins over the phone. That really is a barrier when you think about areas sort of in the Eastern Shore, Western Maryland, and the southern regions of the state, where transportation is a major issue for families. So you have to think about, you may be pregnant, you have a 3-year-old, you have 2 different re-eligibility dates, right? Because you as a parent, you have your own date, and your 3-year-old has their eligibility date, and they're not synced up. So there are definitely, what the pandemic has taught us is that there are ways to improve and not to be so restrictive in how we alleviate barriers and create access for families. How do we make it easier for families? And so again, part of my work is how do we figure out how to bring the end user, i.e. our children and families, to the table to be a thought partner in what we hope to be programs and services that benefit them. But if they're not able to access them, then what are we doing? So to be eligible for a WIC, there are sort of 4 sets of eligibility criteria. But what's really important for me is to understand the income eligibility. So what a lot of people don't know about WIC is that families are qualified if you're at 185% of the federal poverty limit. And so this chart just pretty much shows how large your family, how large your family is, and sort of how much your income, the limits are to be able to qualify for WIC programming. So this slide, I'm really excited to share because in assessments of food access, access to WIC is really important consideration. So the B3 food map here includes the point of locations for all WIC vendors, and they call it vendors, think of vendors as stores. It can help stakeholders locate WIC vendors or stores in their community, and also identify gaps in access. So in the interactive view of the map, so it's not interactive here for the presentation, but if you go online, you can zoom in and you can see sort of which vendors, you can kind of scale in to see like which vendors are in certain regions. As you can see here, I'm particularly concerned with Allegheny County, Somerset, Dorchester, Worcester counties. They're experiencing some issues as it relates to food access, but look at the number of WIC sites that are available to them. It's a major area of concern. So how do you apply? So there are two major ways. You can call the number here, 1-800-242-4WIC, or you can go online to apply. If you go, this is kind of what the health department's website looks. We included this because sometimes you can get lost. I get lost all the time on our state health department's website. So this is a snapshot of what it will look like when you've reached the right place. But then you can drill down and find your local jurisdiction, call the number, get connected. So I just wanted to quickly, because I know we're running up on time, just sort of look at the Maryland WIC coverage rates. So WIC is not reaching enough eligible individuals as evidenced by the WIC coverage rates. So Maryland WIC has higher rates than the US as a whole, but the highest coverage rates for us are high amongst infants and lowest amongst children. And I'm going to go out on a limb and say I think a lot of that is due to the amount of benefits that you're eligible for. So as the child gets older, the amount of benefit decreases. That's a little bit of political, so I'm going to just reserve all the things I want to say about that. But as you can see here, it's sort of this chart kind of breaks it out. So you can see in the state of Maryland, about 54% of children who are eligible are accessing WIC. But as you can see, at age 1, you have 82%. And then by the time you get to age 4, you have 27.2%, significant, right? Also, looking at the coverage rates in 2020, please note that this 2020 data was just released in February 2023. That's how long it takes, unfortunately. But this map does show rates for Maryland WIC participants by county. And what's really cool about the map is that it does break it down into pregnant people, infants, toddlers, and postpartum. So you can kind of really see, and you can hover by this by county. If you're, kind of a local official or you're working locally, you really can use these maps to drill down and see what's going on in your district or your jurisdiction. And what you're seeing right now on this map is a snapshot of Baltimore City. So looking at more recent WIC participation and the number of individuals participating in WIC, we can see that from February 2020, which was the baseline month for before COVID-19, to February 2022, which is like the first 2 years of the pandemic, that overall Maryland WIC participation declined by 1%. But there was a 3% increase in participation by children. So there is like a silver line in there. So in 2022, the total WIC participation in the state of Maryland increased to over 120,000 participants in December 2022. So that's sort of a state of affairs for WIC, if you will. So more recent participation, you can use the B3 maps to kind of sort by participant type. And this map shows the change in overall WIC participation over the first 2 years of the pandemic by county. So if you want to do some targeted outreach, you can use these maps to kind of figure out where you may want to start or intervene. And some factors to note with this data, first 2 years of the pandemic, we have to consider the capacity of the WIC staff at the time. You have to consider the technology capabilities at the time. We're kind of moving to this remote world, and the value of the WIC package participation rate. So as we learned earlier, like some families were able to access over $100 more each month. So there's a lot of things to take into consideration when sort of assessing and making meaning of this information. So here we are toward the end of the presentation. If you are interested in learning more, please visit b3maryland.org. In the homepage, you will see up here, you can just hover over Maryland food access maps. And these are now live, so you can go and take advantage. And this data is updated as soon as we can. So it's very easy for us to update this information. So I would encourage you all to please take advantage of these maps, and thank you for your time today.
So thanks so much to our awesome speakers, and we're going to open it up for questions. I know I have a lot, but I'll give prerogative to any students online or in the room who want to jump in.
I have a question regarding the church and garden project. Sorry, I know that's not the official name of it, but I'm wondering, do you all use any composting programs? Do you have composting programs? And the reason that I ask that is because composting as a practice can be a way to use food waste, but also it can help to make sure that, you know, if you're not using raised beds, that the ground that your gardens are on is more protected from industrial or other pollutants. And I know that's an issue in Baltimore.
Yeah, so for the Baltimore Food and Faith Project, when we were doing congregational gardens, composting was a part of that. And so not everyone composted, but a fair number of our groups did compost. Black Church Food Security Network, at least 5 or 6 of their Baltimore City places composted. The safety of the garden in itself is a kind of a serious issue, and so the CLF did a study, that the safe urban harvest study, where they went around and sampled the produce and the soil from I can't remember the exact number, but it was like over 50 sites in Baltimore City that was growing, to make sure that it was levels that were going to be safe for children. If there was an issue, then they tried to address it through that program.
That's great. And then does the city help with that? Do they help with testing the soil?
I feel like the city, University of Maryland has a program where you can test it for $10 or less. I mean, it's fairly easy to do. I'm not sure if the city is involved in it, but the city certainly encourages people to do it.
Okay, great, thanks.
Okay, I think we have time for 1 or 2 more questions. Yeah, Jeff, go ahead.
All 3 presentations were great. Thank you very much. I have to ask you, Susan, how does the US compare with other developed countries on food insecurity? Your numbers look quite depressing. And I'm wondering if this is another instance where we're sort of behind the pack.
Thanks, Steph, for that question. Yes, the US does lag behind other developed countries, especially Western European countries. We are poor. Our rates of food insecurity for our people of color are even worse than other developed countries. So in terms of, we might be closer for those people who are in white ethnicity or comparable to other developed countries, but when it comes to the people of color, our levels of food insecurity are worse.
So it's kind of like maternal mortality, where we are way behind.
It kind of tracks the same.
Yeah, I guess they're related, huh?
Yeah. I guess the only good message there is lots of room for improvement. Right? So I guess the last question I wanted to ask is, you know, given, and I'm asking not to go far, given sort of these changes that both you and Felicia and Darriel all alluded to, you know, amid COVID, is there hope that in the federal food programs that some of these changes will come back, even though they're leaving temporarily, hopefully?
So the couple of good things have happened, even though that the emergency SNAP benefits have gone back this month, actually, to the pre-pandemic levels. During the pandemic, the USDA started using a new formula for the thrifty program, so assessing levels of poverty and the amount of money given to families was improved and modernized, so that has helped, not as much as we want. Other things that are happening is there is actually legislation in Congress right now presented by Senator Gillibrand about making WIC physical presence waiver permanent. So that's one thing, but we do know that WIC is changing too, that we are becoming more flexible, and there is a physical presence requirement, but that is once a year. The rest of it can be done remotely, and in fact, benefit issuance was required by 2020 to become national, but everyone's moving toward remote benefit issuance, and they're studying online benefit redemption, and so there's a lot of hope. But the biggest change that's coming is they're proposing a rule change to change the food package. One thing that happened during the pandemic was that the fruit and vegetable cash value benefit increased a lot, and we've kept that. And it's not permanent, but it's through September of this year. But the new food package revisions have the fruit and vegetable benefits staying high, adding fish as a protein to the food packages, and also making the food package more culturally diverse and acceptable to different cultures by adding different grains, by adding different sources of milk. They're looking toward pathways to other cow's milk alternatives. And also there's just in general making things more equitable across the age groups. And schools are also looking to improve things, and even for the summer food program for rural counties are keeping the non-congregate food, so people can go pick up their food for the kids in rural counties. Now it's USDA labeled rural counties, so in Maryland it's only Caroline and Garrett County, but hopefully that will improve as well.
I thought we had to end on a positive note, but I think this really speaks to public health being in all settings. So thinking about, partnering with faith communities, thinking about how we elevate the use of data that you spoke about, Felicia. So I encourage everyone to check out those maps and think about how we can use them in the work that we do to promote access to healthy foods and health equity more broadly. But just really want to thank everyone for being here today, and please join me in thanking our three speakers.